So let's jump in. So I got questions from. I asked my readers, like what are the questions, and I got several questions. So if we could just jump right into it.
Absolutely.
So firstly, starting with screening for OCD. OCD, I think you will agree, is underdiagnosed. It's often missed. A lot of patients with OCD don't even
Yes.
get diagnosed. They feel shame. They hide the illness, and probably we need to do more. Like everybody whom I feel that every single patient that psychiatrists evaluate, they should screen them for possible OCD because it can be along with major depression. It can be present along with bipolar disorder and so on. So what would be some tips that you would have for like how to ask the patient, because OCD can present in so many different ways.
Right, exactly. And we've had this experience with people who are actually very, very trained psychiatrists and good clinicians who have missed OCD and missed it in their own children. So,
Wow.
yes, which over the years I've sort of understood why many people think of OCD as hand washing, checking, overt behaviors. Many OCDs. I wouldn't say the majority, but a lot of them have sort of what we call used to be called pure O, but it's really not pure O, it's pure M. So both the obsessions and the compulsions are in their head only. So they're very clever and they're able to do things that are not shown to others. And so there's a variety of content that
What
OCD can latch on to.
I didn't understand. Pure M. What is the M?
Mental. So
Oh,
everything that is
yeah.
happening, it's an obsession in their brain and mentally, and they do a compulsion that's also mentally. For example, a very small prayer or
Yeah.
an elaborate ritual inside their brain. But let's go to how we assess it and how somebody who may not be an expert on OCD would assess it. It's a really good question to ask people if they have things, thoughts, or images, or even urges that are uncomfortable for them, that then in reaction to that, they have to either do something or think something to cancel it out.
Very good. Excellent. Excellent. Can you repeat that, please? Because that I think is a great. Like if we ask that question pretty much exactly as you said it, it explain goes to the heart of the concept that we are talking about. Instead of giving specific examples, because one of the readers wrote about how the different examples she would give. Do you do this? Do you do this? Do you count? Do you check the locks? We cannot give every example,
Of
and
course.
instead we should explain the concept behind it, right?
Exactly.
Do you have
Exactly. So
thoughts,
I'll just
impulses, or yeah, please.
right, right, exactly. So a really good question is going to be, do you have thoughts, images, or even urges which are intrusive or uncomfortable for you, or kind of things that you don't want to have, to which you have to, you feel you must do something, a behavior or a thought to cancel it out or to neutralize. And it's to neutralize either the distress that comes from it or the consequence. For example, and you're afraid that you might cause harm, so then you need to negate the harm that might occur. And that's a very good question. And if they say yes, you want to say, do you do this a lot? And does it take you a lot of time during the day? Is it intruding in your functioning daily?
Right, right. So then you will, if they say yes, then you would get more details about what are these thoughts or urges or images, and
Right.
what do they do, and then like you're saying, like assess the severity, because anybody can have symptoms just like any other mental
Exactly.
disorder, and it can be present in a mild degree. So how
Exactly.
bothersome it is, how much time does it take, how intrusive it is into daily life, and so on.
Interfering in your daily life, because a lot of people have symptoms and they live with them quite comfortably and they're not increasing, they don't demand a lot of attention, and they're not interfering with their daily function. The other thing that I would recommend, as if a person is just suspicious, or even before they're suspicious about whether or not somebody's got OCD, is there's a very, very easy self-report. It's called the OCIR, so Obsessive Compulsive Inventory Revised, and it's just an 18 item self-report that a patient can fill out in the waiting room,
Yeah.
and it really quite well identifies whether somebody is got OCD, and then you can take it from there.
Now the
Is
OCIR, Yeah, so I was going to ask about that. The OCIR is an 18 item. It was developed by Edna Foa et al.
Oh,
Uh,
exactly. Our
right.
clinic had
Yeah.
developed it and tested it, and it's got
Yeah.
really good parametrics.
Now,
And
can people use this? Can people use this without permission? Like, do they have to write to Edna? I actually emailed Edna yesterday
it's
asking
public
this
domain.
question. Yeah.
Right. This is a public domain in self-report, free for the use, and you could just Google it and download it with no permission required.
Very nice. So I will provide a link to that on my website because not all the questionnaires are available. For
Right.
Eric Storch has the Florida obsessive compulsive disorder scale, and I wrote to him, but it's not, you cannot freely use it. You have to write to him
Right.
to get permission. Every person, yeah.
Right. So this is our approach, and this is an approach that we've taken at the University of Pennsylvania, that we try really hard not to make things proprietary, so that people can use them freely, that they can download them from Google.
Yeah,
Patients do it, actually. Even patients can find it.
yeah.
So if one wants to use something that is more elaborate, we can talk a little bit later about that. There's one that's called the Yale Brown OCD scale, and it is also public domain. Anybody can use it. You do not have to ask permission. Those are the two that I would recommend using, since they're free
Right.
and
So the
very valid.
that's the famous scale called the Y box, the Yale Brown Obsessive Compulsive Disorder Scale. But the Y box is clinician rated, right? Like we have to ask questions and rate it, and the
It's
and the
got a self,
OCIR is
exactly. It could be a self-report as well. However, the OCIR is easy for the client to
very
identify.
very
The
easy.
iBox is more difficult, and it requires some clinician questioning and knowing a little bit more about OCD to ask the question. Otherwise, clients will deny some things because they don't understand why that's not important. Why is it important not to remember, or things like that? They won't identify it, so it underestimates. Yeah,
So the
it's
OCIR is probably a better place to start.
self-report, easy.
There was another question which we might as well ask right here as we are talking about OCIR. Is one of the readers asked, how should we monitor progress? So let's say we start treatment. Over time we want to get an idea how the severity is changing over time. So
Right.
would the OCIR questionnaire also be useful for this, where you can look at the score like after 1 month, each month you can look at the score?
It is possible to do that, but for that I would actually recommend just the Y box that we had mentioned too, the Yale Brown. I would recommend that one, but the severity rating scale. So you don't need to look at the items again, which is the checklist. You just need to look at the severity scale, which includes time spent, interference in your life, how distressing it is, and do you try to not do it, and do you succeed, things like that. That would be one that you could use. It can be used weekly. I use it beginning of treatment, mid treatment, to see if it's going in the right direction, and then after treatment as well, to see what the outcome is. And that's a very good, valid way of monitoring progress.
Great. So just to summarize this before we move to the next topic, you're saying that the OCIR will be useful to identify different types of obsessions and compulsions because there are 18 items.
Right.
But the buy box severity rating will be, once you know that these are the 2 or 3 or whatever, then to monitor their severity, it makes more sense to use the severity scale from the buy box.
Right. I mean, the OCIR also has severity because it's on a scale, so it has
Yeah.
severity. It's just that the Y box has been, it is very, very useful in that respect. It's been used a lot. So
Okay.
either, and then the OCIR is a self-report, and the Y box can be somebody administering it, which would be.
Excellent. Excellent. And I will provide all these details on the website.